Guys, welcome back to the Mission Empowered podcast with me, your host Emily, and today I'm joined by the gorgeous, fabulous, wonderful Estelle, who is we'll go into how we know each other, but a pelvic health physiotherapist. And I really quickly wanted to press record because the best part of this podcast is where we chat shit. That is why people listen, so it is normal and it is not too formal. So Estelle was just saying you're in a house where you've got every man and the dog and the hairdresser in this morning.
Yeah, so that the house might get a bit rowdy. So I'm hidden away in a room, in a bedroom.
Nah, you're amazing, mate. You're amazing. Okay, so girls, welcome back to and males maybe. Welcome back to the podcast. So super excited, and I'm sure you can hear in my voice how excited I am about this episode, and I've been talking about it on my Instagram. It is something I've wanted to do, not just since being pregnant, but just for so long. Like, me and Estelle will go into how we know each other and how long we've been like connected for, which is always quite nice to know. But honestly, Estelle is my go-to. Since I genuinely think I messaged her when I was like 4 weeks pregnant, was like, Estelle, I'm pregnant. Am I okay? Like, what should I do? Should I do this? Is doing this? Because even me being pre and postnatal qualified in exercise and nutrition, you are a pelvic health physiotherapist. So introduce yourself. Tell us a little bit about your job, and then we'll do a little bit about our background.
Okay, my name is Estelle Riley, pelvic health physiotherapist, specialising in that area. You qualify as a physiotherapist and then you can choose an area to go in. And for me, it was either, before actually being a physio, I didn't know whether I wanted to do midwifery or physiotherapy. And so this has kind of moulded the two together, because I still feel like I'm helping women, but I'm getting the exercise side, because I've got quite a strong background in exercise, and I like that type of stuff. So I found my little niche, my little area. I work across 2 different NHS trusts, being a specialist pelvic health physio. I work in Liverpool Women's 2 days a week, and I work in Wirral Community Trust 3 days a week. I absolutely love my job. So I have kind of, with pelvic health physio, there's loads of us, and there's loads of different specialties within that as well that you kind of can go into. There's pelvic pain, there's prolapse, there's you've got incontinence, bowel problems, sexual dysfunction, antenatal and postnatal. There's just lots of things that are involved in pelvic health physiotherapy, and I found that all of them make me feel like I am helping the women of our little local community and population.
And you have your own side business.
Yeah, so I do private physio, pelvic health physiotherapy as well. I don't do it every week. I do it every few weekends, maybe. So
what's it called? Watch your Instagram, because this is what I always like to help with, because people follow you and message you.
It's at Physicate Physiotherapy. So Physicate _ physiotherapy. So if you feel like anybody needs an assessment, whether that be antenatal through pelvic girdle pain type of stuff, or postnatal, or even later on in life as well, because, you know, like I was mentioning before, there are a lot of things later on in life that can affect the pelvic floor and affect you mentally, really. So it's always nice to have a little check.
Perfect, babe, 100%. And so we'll do a little bit of background. So me and Estelle, we met in college, didn't we? Now, everyone who's listening to this podcast will think, oh, Estelle's a dancer. No, I went to college multiple times.
Oh, I used to dance, mate.
You did? Actually, that's a lie. That is exactly, because we met in college, and then we were like, we recognise each other, and we think it was from dancing, didn't we? But I actually went back to college and studied sports massage therapy, which is where we met. And that was your sort of start of your physio journey, wasn't it? You carried it on then.
It's stupid, really. I started my physio degree, and in the same year I did my level 4 sports massage. So I was doing my first year of degree and that as well. It was horrible.
Yeah,
God awful.
Yeah, I really enjoyed that course. It was really interesting.
I know.
Really good, really helpful. But go on.
We just hit it off though, didn't we?
Yeah,
come in and we'd be like, have you done this assignment?
Yeah. Oh, don't make me cringe. I was very like I loved the hands-on stuff. Loved it.
Yeah.
like the ethical side of things is like, I'll just be honest, I find it quite boring,
Mm.
like all the big note taking and assignment
Yeah,
writing and stuff,
yeah.
but the hands-on stuff, yeah, I love it, and the education side. So that's where we met, and then we've just sort of like stayed in touch, haven't we, like over
Yeah.
the years. And now Estelle, I am so proud to say, is like my reference when it comes to taking on clients who maybe, you know, I feel like they need like if someone comes to me and they know they've been diagnosed with prolapse, or they're suffering with what I know to be pelvic floor symptoms, you are my go-to
Thank you.
100%. And you are now helping me out with the Empowered Mamas course. I'm running stuff by you as that, which I'm so excited about. I could cry. We're going to make sure that this like Empowered Mamas course, for anyone who is pregnant, we're going to talk about pregnancy in a minute, is getting the best knowledge. They're not just getting, do this exercise and do that. They're going to get solid knowledge from a pelvic health physio, which again is just another level of knowledge when it comes to exercising and being aware of your body. Like within 2 minutes, I just clock watched when you said about why your job is important and pelvic health is important, you just listed off, I don't know, like 10 things that I guarantee people will go, oh shit, I didn't even think about that.
I know.
I think with pelvic floor, which we'll get into that now then, but I think with pelvic floor, people just think pelvic floor is to do with wetting yourself, not wetting yourself when it comes to having a baby. Like, so I'm going to give the floor to you now.
Okay.
In your terms then, because I'm sure you'll be better at this than me, what is our pelvic floor for everyone listening? Because this is one of the questions I think I sent you. Someone messaged me on Instagram and just said, what is my pelvic floor? Because it's one of them terms that we go,
Yeah.
yeah,
Okay.
okay, go.
So the pelvic floor is a series of muscles, okay? So it is a muscle that we don't see, but it has such an important role in pressure management, continence, support of organs, and sexual function. So it's very, very important, but because we can't see its range of movement. We don't realise how important it is until something goes wrong, because it does work autonomically. So it works without it can work consciously and subconsciously because of the types of muscle fibres and stuff like that. So just got my little model. So there's your pelvis. Okay. There's your pelvis, and that's the muscles under there.
Yeah.
Okay, so just giving you a bit of a visual there, but my favourite one to go for is a drawing that I made a long time ago. I made this probably before I was even doing women's health stuff. And just for you to have a little look there, that shows you all the different colours are all different muscles that are involved within the pelvic floor. Okay, so especially this area here. All right, this is your back.
Do it visually. I'm going to test you now. And for people just listening as well.
Okay, yeah. So you've got your pelvic floor has got these muscles that attach from the front of your pubic bone. Okay, so your pubic bone at the front, and you've got your coccyx at the back. You've got a number of muscles. One loops around the vagina, one loops around your rectum, and then there's a couple more that kind of loop and then insert from the front of the pelvis through to the back of the pelvis. And like I said, they are really important in support. Okay, so when they contract, you've got muscles within there that will contract in different directions. So when they all work together, they create like a bit of a dome shape. And a muscle, just as with every other muscle in your body, has to have contractile element and be able to relax as well. So for ladies who are watching me, I'm using my bicep as a reference. If you straighten out your elbow, that's your bicep lengthened. If you contract and you bring your hand up towards your shoulder, that's your bicep contracting. So within that movement, that muscle is lengthening and shortening to do what you want it to do, to generate a function that you need. If your muscle is in a state of weakness, shall we say, which most people think the pelvic floor, if they've got symptoms, they think, oh, I've got a weak pelvic floor. If that's the case, then it's not functional because it hasn't got the strength to contract against the pressure that it's needed. But equally, you can get a pelvic floor that's classed as overactive. So it's where there's a bit of a disagreement around the terminology within the pelvic health world, okay? But overactive is a good word to use, where the muscle is in a state of contraction, shortening, stiffness, and then it can't lengthen. It struggles
Estelle,
to lengthen.
can we just touch on that? Because that'll be a lot of people that, like you said, people just think I wet myself because it's lengthened from childbirth. But can you just give us some examples? Because I know we've had this discussion. What would because I know symptomatically they can be similar, but what would cause an overactive pelvic floor where someone's in a constant state of contraction where
Okay.
that's where it's not functioning?
Do you know what? It's more common in my experience, my clinical experience, than a weak pelvic floor is. So the majority, and I'm going to give it a ballpark percentage, and again, it's not. But I'd say probably around 85% of the patients that I see who have pelvic floor dysfunction for one reason or another, or pelvic floor symptoms, should we say, have an overactive pelvic floor. And the reason being, a lot of the time, is we're women. We do everything. So we work, we're mums, we have anxiety, we have stress, we have relationship issues, we have work stresses. There's so many things that go into how your body responds, and the pelvic floor is so emotionally linked, because I like using this little analogy, right? You've got your shoulders. When you're stressed, your shoulders raise to your ears. When you're stressed, your jaw tends to clench. But your pelvic floor recruits and stays short because it's in a state of threat. So we have to be careful here. So it does this to protect you. And sometimes a good way of thinking about this, and for those ladies who have coccyx pain, who you may have, or who develop coccyx pain through pregnancy or postnatal, your pelvic floor attaches onto your coccyx, right? So a dog, if you were to look at a dog...
Just basic anatomy, coccyx, lower back pain we're talking about.
Coccyx is the very base of your spine, and it is like it's our tail. Many years ago,
your
when
tailbone,
tails, it's your tailbone.
So just for people who are listening and thinking, where the fuck's my coccyx? Like that little nubbin, isn't it, at the base of your spine? That's what we're talking about. Yeah, carry on. Sorry.
So that actually moves. So it's got a few static joints, but then at the very base, there's two joints that move, and they are our old tail, and the pelvic floor attaches onto that. So if you can imagine that the pelvic floor is moving and contracting and relaxing, that joint is going to move, right? If your pelvic floor is short, it's stiff, it's not really moving properly, that tailbone is going to be tucked right under, and that can develop pain. And if you think about a dog, when it's happy, its tail wags and it's up. When it's sad and anxious and scared, it tucks right under, right? So it's the same with us. We're scared, we're anxious, all of those things. Our pelvic floor is going to be shortened and stiff. And the more you are in that state, the longer it will stay like that. And that's when we get women who develop stress incontinence. That is quite a big one, because stress incontinence is a pressure management thing, and how the pelvic floor is recruiting up. We can have urge incontinence with that as well, where they get an urge to go and they've got nowhere else for the contraction to go to. Because it's already short and stiff.
Yeah, perfect. And I think that is absolutely huge. So last week, the episode that is out before this is all about stress and us being in a constant. And so I knew when I asked you, why is it we have overactive, and it is lifestyle and stress, and like you said, everything. I describe as like I describe that you have a life plate, that you have this like buffet plate that you walk around on, and everything that's part of your life goes on this plate. And when we have too much and things start to falling off the plate, that's things falling off from our health, and pelvic floor is one of them. And I think you've probably seen this now as well. The reason I really want to talk about pelvic floor, I want to do this podcast, is because we are getting the confidence to talk about it more. Whereas for years and years, people would just accept the symptoms and just be like, oh, well, it's because of,
I'll just touch on stress, like an overactive and a shortened pelvic floor, just a bit more. That will give you symptoms. If you have symptoms of stress incontinence, urge incontinence, painful intercourse, so when your partner may penetrate, if you get pain, not just at the entrance but deeper in, or pain even after you've had after you've orgasmed or after sex, that is essentially your pelvic floor is in a state of spasm, and it's short and it's stiff. And so that's where we work a lot on pelvic floor relaxing and stretches and breath work and stuff, and we can go into that if you want a little bit later.
We'll talk about that in a second.
To pop that in just in case.
So okay, honestly, this episode could be so long, but this is what we're going to do on the Empowered Moms, and we're going to go into it more. But okay, so we've covered like what our pelvic floor is and things. What is you listed off for the main purpose of our pelvic floor, or the main purposes that, again, I don't think a lot of people know. So we can talk about day to day, maybe a little bit in the purpose in exercise, stuff like that as well.
Okay. So like I mentioned earlier on, you've got the roles of the pelvic floor is to support your internal organs,
Yeah.
to maintain continence and to
Mm-hmm.
assist with sexual function. Okay, so and
Mm-hmm.
this is that, and there's pressure management. In a
Mm-hmm.
day to day, like I said earlier on, you're not gonna feel it contracting against pressures. So abdominally, interabdominally, so your abdominal
Yeah.
canister, you've got
Yeah.
your diaphragm at the top, you've got your pelvic
Yeah.
floor at the bottom, and you've got your abdominals that wrap around. Okay, so that's your
Yeah.
abdominal canister. And in order for you to do absolutely any activity, from getting out of bed in the morning to brushing your teeth to sneezing to going for a poo, anything requires inter-abdominal pressure.
Yeah.
And the pelvic floor has to recruit up to match the level of the pressure, otherwise
Yeah.
you will develop symptoms. So when
Yeah.
you are working out, for instance, your
Yeah.
pelvic floor, to prevent you from having incontinence or developing prolapse symptoms, your
Mm-hmm.
pelvic floor will recruit up to the level that you need it to.
Push it,
So
put pressure in.
for our women who, sorry to say, who are in our CrossFit era,
Yeah. Yeah.
CrossFit's brilliant and I'm all for it. But the problem that I see a lot of is there's been a false representation of super strong CrossFit women, and they wet themselves.
Mm-hmm.
And
Mm-hmm.
that's been seen to be, oh my god, she's done so well there, she's wet herself. The problem with that is that you've overridden how much your pelvic floor can support you, and then over time
Mm-hmm.
that's going to give you dysfunction. It's not
Mm-hmm.
normal to leak, so your pelvic floor
Mm-hmm.
should be able to recruit up to exactly what you're asking it to do. So
Mm-hmm.
just because your legs and your upper body can hold that weight, the pelvic floor can't,
A
unless it's
million
trained.
percent. Yeah.
Yeah.
And I think you obviously know where I go CrossFit as well. Like my CrossFit coach is also pre
Phenomenal.
and post
Yeah.
pre and postnatal trained, and that is, like you said, it is a very common misconception of that, like, what, maybe not even just in CrossFit, but going on trampoline. I was
Yeah.
at Henry the other weekend. I was like, oh, I'll wet myself for go on that. Like, we're
Mm.
so used to normalizing like
Oh,
these
yeah. Yeah.
symptoms
So for
rather than understanding them
yeah,
and looking at what we can do to help fix them and
because
relieve that. Yeah.
it's so common, but it's
Yeah.
not normal, and we need to remember
Yes.
that
Yeah, it's
there's a
common, but it's not
difference.
normal. Love that phrase. Yeah, 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 definitely. Okay, cool. So we know what our pelvic floor is. We know the job that it does clearly now. Okay, basically, we want optimal pelvic floor function for our day to day,
Yeah,
right?
yeah.
Would you say the biggest thing? I don't know this answer. I'm just throwing it out there to you.
Okay.
The biggest thing that alters our pelvic floor, would you say it is pregnancy? And I don't mean giving birth, I mean the whole journey, or we're in like the spectrum. Oh yeah, what is the biggest thing from pelvic floor that affects it not
No,
functioning properly?
no, our bodies are designed to birth children, right?
Love
It's
this
the
because
other.
I sorry, just before we carry on, I think people think pregnancy is. I think people just think I've had kids, I've got shit pelvic floor. Okay,
Yeah,
so just
and
you're
that's a
gonna
sad.
miss off this, yeah.
It's sad, really, because just because you've had numerous amounts of children doesn't mean
Yeah.
that you should have symptoms. It's never, if a lady came to us and said, I've had 5 vaginal deliveries, I wouldn't go, oh well, I'm not surprised you're wetting yourself, love, off you pop. And it's not normal. So we can help you, like, re-educate
100%.
your
But how
pelvic
many
floor.
people? Yeah, how many people would think, oh, she's had 5 kids, don't worry about your pelvic floor? Yeah.
Mm. There's going to be there's more changes than just the pelvic floor. Like, we're talking about the muscles, but
Yeah.
pregnancy changes things, and labor and delivery changes things about your abdominal support. Just in that
Hmm.
period of time, your abdominal support, you can have there's research to say that there's an element of vaginal I'm trying to say this in the correct way so people don't freak out, but when you've delivered vaginally, there's going to be a potential element that there's a little bit of laxity or descent
Hmm.
postnatally, but it
Hmm.
doesn't mean that it's going to last forever.
Hmm.
So
Hmm.
we've seen quite a few women come to us, or come to me even privately, and tell me that they've had a baby however many weeks ago and now they've got a prolapse, or now they feel baggy, or now they feel this. Well, I'm not. When you deliver, when you have a baby, you've got your abdominal muscles here, and you've got a connective tissue band that goes from your sternum all the way down to your pubic symphysis joint. Okay, sorry, I'm just going to sit up for the people who can see down there.
Yeah.
And it's called your linea alba. And when we have children and babies grow, 100% of women's abdominals will gently separate, not painfully, and that's how baby gets to grow. And then over time, what should happen is they will come back to normal, just naturally. Some people need a little bit of extra.
You're going to be my lifeline when the baby's here, because mine is definitely separating.
But some people need that little bit of extra support, that extra bit of training. Some people's collagen makeup genetically is different, so sometimes they have what's called a diastasis, where their tummy muscles don't come back together fully, but just because there may be a little bit of a gap, we need to make sure the tension is right. So we work on the tummy muscles and we work them in the right way. It's not about sit-ups and planks and that. Don't go doing anything like that, because that puts pressure on your pelvic floor. But just going back to the pelvic floor through pregnancy and delivery, you've had a baby, you've got a similar, it's called like a hiatus, where you've got your anus, your vagina, and your urethra come through like a bit of a gap. That will separate for you to allow baby to birth. It separates, and then over 8 to 12 weeks time, that will come back again. So please, ladies who are pregnant or just delivering, please don't look at your vagina 2 days after you've delivered, because you're gonna upset yourself, and it's not necessary, because you won't always be like that. But you've delivered this beautiful baby. Do you know what I mean? So pregnancy 100%. And delivery doesn't always mean that you're going to have pelvic floor dysfunction and problems for the rest of your life, but you may need and may benefit from a pelvic health physiotherapist looking at you within round about, personally, I would only examine somebody from around about 12 weeks. So vaginal examination, 12 weeks postnatal. There are people who will see you a little bit earlier, from 6 weeks, but I know the anatomy and what happens, and for me it takes around about 12 weeks for your anatomy to be at a sufficient position for me to examine how your pelvic floor is able to recruit.
I just love you. You're so fabulous, because you are so fabulous. And I literally was talking about you yesterday to one of my friends, because it just shows how just like professional you are, to say that it is a little bit like when you say, like, if someone goes to get examined post birth, we had this conversation when we met up last week. If someone goes to get examined post birth, you were saying to me, they are absolutely still going to have this hiatus in their pelvic floor. They are still going to be symptomatic, because at 12 weeks, not that everything should be back together, but it's giving you a bigger, better picture of, okay, this is probably what you need to work on. Whereas at 6 weeks, you're going to be told that anyway, because things aren't back. We'll talk about, I feel like we need to get you on. Do you know what? Let's talk about pelvic floor. And then in our diary, we will get postnatal, a session on postnatal on, because I think that's really important. But that's why, just dead briefly, that's why going back to exercise too soon after having a baby is, you could get through the whole of pregnancy and look after your pelvic floor and do everything you need to, the strengthening, the lengthening, the relaxation. But if you go back to exercise too quickly post-birth, that is where you could actually be doing more harm than you ever did in the 9 months that you were pregnant. And this is why I will be on the phone to you saying, Estelle, I want to do some exercise. Like, it's going to drive me insane. What can I do? Because I don't want to do it. Like, you will be my absolute go-to. But
there's so many things you can do before the vaginal exam. So breath work's really important. And I'm a big advocate of getting your abdominal pressure kicking back in, drawing your abdominals in the correct way. diaphragmatic breathing, pelvic floor. You can, as soon as your baby has been delivered and your catheter is out, you can begin the process of lift your pelvic floor, release your pelvic floor. You can do that because it's reminding you your pelvic floor, it does have a job to do, but it knows that anyway. And our bodies, we need time. I went on a course not too long ago, and it was a lovely lady who was delivering the course, and it was about electrical stimulation. Fermi, her name was, she was fab. And we were in agreement that as somebody who's had a baby, granted I've only had one, and I had a delivery and I had a second degree tear, and I had all of the things that a lot of my women feel. Your body needs time. That's it. Give it a little bit of time. Don't rush things too much. If you are going back to exercise 2, 4, 6 weeks after you've delivered, you are going to put excess stress on tissues who are trying to heal. And if you support them like you would support your friend's mental health, just say, they will get there better and stronger and quicker. If you add stress too early on, in my clinical opinion, I'm not saying every physio is the same, but I would probably just ask you to breathe, gentle pelvic floor release. I'd assess your breath. I can do those things, but I'm not going to examine you internally until, personally, 12 weeks. But that's me.
But you're amazing, so I would back that as well. Amazing. Honestly, that's taken us on to our next little segment really nicely. So we know, so in pregnancy then, the purpose of the pelvic floor is still the same as what it was before.
Support.
Support, Now, obviously, we know in pregnancy that the support probably becomes a little bit more important because the weight bearing increases.
The weight changes.
And one of the things we get told in pregnancy everywhere, do your Kegels. Do your Kegels. Now, when I speak to people, because obviously I've been pre and postnatal qualified for a long time, I know about Kegels and stuff like that. But when I talk about this with clients, I would probably go to say 9 out of 10 times, I will say to someone, do you understand like how to do like connection breath with your pelvic floor? Their answer is no. So I know 90% of people listening to this podcast will be thinking, oh, thank fuck they're going to talk about this because I've got no idea. And I'm either pregnant being told to do Kegels, or I have been, we know on some of the questions, someone's got suffering with prolapse and has been told to do Kegels, but we don't get told to do them. And I personally think, unless you are spending the time like yourself and me doing the courses and stuff, I actually don't think a lot of doctors would know how to do a Kegel or explain how to do it. So let's talk quickly then. What is a Kegel? Why is it important? And how we do them. And then we're going to talk about the opposite of a Kegel, which is relaxing, because like you said before, we want our pelvic floor to be exactly the same as any other muscle in our body. We want it to be strong, but we need it to be supple. You can't just be strong because then you're stiff and then you get injured. And it's the same with pelvic floor, right? So, babe, over to you. Let's do a Kegel. And let's talk about what a Kegel is.
Okay, so a Kegel is just a name that was given to a pelvic floor lift, basically by, I think it's a name of somebody.
It's Dr. Kegel.
Who developed it.
And it was a fella.
Yeah, exactly. So all it is a pelvic floor contraction and relaxation. But the problem is people think a Kegel is and lift, and lift, and lift without the release in between. So pelvic floor, general pelvic floor contraction can happen in a couple of ways. So you've got your slow contraction and your endurance, where you can contract up and you can hold for however long and then relax back down. And then you've got your fast contractions. So your longer contractions are going to help you when you need endurance, okay? Your faster contractions are going to be good to train for the likes of sneezes, because that's the muscle that will kick in. They're the muscles and the fibers of the pelvic floor that kick in to meet fast pressure. So a cough, a sneeze, a jar, like a jolt or a spring, something along those lines. Those pelvic floor muscles will recruit up to match the pressure that's pushing down on them.
Can I just add something in just to remind people, because we said it at the beginning and I just want to remind them again. your pelvic floor is an involuntary muscle. So as much as we can do things to strengthen it, it should work, like you just said then. On a sneeze, it's reacting. You don't
Yeah.
have to think, shit, I'm going to sneeze, and
Mm.
then
Yeah,
contract
you
it.
don't
Yeah.
naturally, like, as we develop and as we grow, the pelvic floor will react without you having to have that conscious thought.
Yes.
However, for all women who have had a series and a long period of time where they wet themselves with
Yeah.
sneezing or laughing or any of those things,
Yeah.
let's work on it consciously, which will
Yeah.
then remind it of its subconscious.
Subconscious.
Yeah, that's how
Perfect.
I word it. So
Yeah.
if you have had symptoms,
Yeah.
and I would probably say to you, right, okay, contract, cough, release, contract, cough, release, and I'd ask you
Yeah.
to do that consciously
Clever.
to then
Yeah.
kind of have
And
that.
I don't know whether this is right or wrong, but me being pregnant now, I don't know. I always sneeze when I'm driving. Don't know why, but like if I can feel a sneeze coming on, because I am getting bigger, I am thinking, contract sneeze. Is that the right thing to do or not? Just because
Yeah,
I'm pregnant,
yeah, no, it's fine. You're not doing yourself any harm. Your
right?
brain has got this pathway that's being built, isn't it, between your pelvic
Yeah.
floor and your brain? So contract up, hold your tummy if you want to, because it'll just take that extra pressure off.
Yeah. Okay.
Yeah. So that's basically what a Kegel is. It's not just contract, contract, contract. It can be contract and hold, 2, 3, da 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 da, and it can also be and lift and release and lift and release.
So
Okay,
you
so
got like fast contractions, and then would you
lower.
call them slower ones?
Yeah.
Okay, so lols. I met Estelle like a couple of weeks ago on a Saturday, didn't we? Went to the cafe for
Yeah.
ages,
Yeah.
and we were sat in the cafe. You were having your porridge, I was having a tea cake, and then we were like, right, should we do some Kegels in the cafe? Lol. So can we do one now? Just so I'll do it, you'll do it, and we'll talk through it, and then anyone who's listening, we can practice it together, because I always think it's good to do things like this.
Yeah.
Go on.
Do you know what
So
I want you to do?
you talk us through.
Yeah, I will. So I'll talk about it and then we'll do it all together. I want you to breathe
Right.
in through your nose first.
Yeah.
Engage, like, so when you breathe in through your nose, I want you to envisage that your rib cage is widening. Make
Yeah.
sure that when you take a breath in, that your shoulders don't raise to your ears. I want the breath to go right down to the base of your ribs, okay? So when you breathe in through your nose, that's what's going to happen. You're going to widen out through your ribs, and then you're going to breathe out as if you're breathing out through a tiny little straw, and you're going to control that out breath, okay? So for those of you who are watching, if not, you can just listen to me breathe. We're going to breathe in through your nose and then breathe out through your mouth. Okay, and you're going to aim for around about a 3-second in breath, but whatever, if you find that that's too hard, you don't worry about the time.
Yeah.
Breathe in through your nose and out through your mouth, and the out is when you're breathing out is when I'm going to ask you to lift through your pelvic floor. Sorry, my dog's barking.
It's okay. It's normally buddy.
So the breath in is to try and release and lower your diaphragm, so your pelvic floor during that period will release off, okay? And then when you breathe out,
it's good to visualize that as well.
yeah. So breathe in through your nose and imagine that your pelvic floor is relaxing all of its tension off. And then as you breathe out is when we're going to squeeze and lift through our pelvic floor. And the best way to, in my opinion, to envisage that is as if you are picking something up with your vagina or your back passage, okay?
Yeah.
You can either start from your back passage. So for those of you who can see this, and I'll try and talk it through as well, the back of your pelvic floor has got a wider muscle kind of mass, if you like, across where your back passage is, and then it goes a little bit shorter at the front. Yeah, a little bit narrower. So towards the back here is where you're going to imagine you're drawing in and lifting up, okay? And then once you've got that, you can bring the contraction forwards as if you're trying to, as if you've got like a corset and it's going from the back of your coccyx all the way to the front, or a zip from back to front. So
can I say my little one that I said in the cafe?
Yeah.
So I do bum hole, baby hole, wee hole. That's how I imagine mine. So imagine not squeezing your bum cheeks, but holding a fart. One of the best ways I say to do this is imagine if you were in bed with someone you just met, you slept with them for the first time, and you really needed to fart, but they had their hand on your bum and you didn't want them to know you were holding a fart in. That is the type of fart that you're holding in.
Yeah.
And then So you're holding your fart in, but not squeezing your bum cheeks, and then you're holding a tampon in and then holding a wee in.
Yeah.
That's how I've always like visually cued it. Would you say that's right?
It's a really good way of doing it. Yeah.
Yeah.
So
So then in your head you go bum hole, baby hole, wee hole.
and just to like touch on what you've just said, which was really good, the pelvic floor is a muscle that can be isolated, so you don't need to use your legs, your bum cheeks, or any. There shouldn't be any extra movement. You should look at yourself in the mirror, lift up through your pelvic floor, and you shouldn't see anything else move.
Yes. Yeah.
Okay.
Let's do it. Let's do the exercise. So go on, I'll do it with you.
Are you ready?
You can talk if you want, and I'll do the breathing.
Okay. Are you ready?
Go.
I want you to take a deep breath in through your nose for me, Em. And when you're ready, you're going to begin to breathe out through a tiny straw and gently lift up through your back passage and draw that contraction forward through to your pubic bone at the front. Okay? And then take a nice breath in again and let the pelvic floor release off. And then you can contract up again for me. So pull up around your back passage as if you're stopping yourself passing wind. Bring it forward to your pubic bone at the front. And don't forget, when you breathe in, let it go. You should feel a release through the pelvic floor.
Yeah, it feels really relaxing, I think, because it's all about focus, isn't it, and breathing and stuff, and no, feels good.
That's good. And then with that one, you can hold your pelvic floor for as long as your out breath will allow you to, and as long as your pelvic floor has got the endurance to stay there. You could aim for like 10 seconds with that one and see if you can hold the pelvic floor.
That's what we did in the calf.
Yeah. and then again, just going through to your faster contractions. So what I'm going to ask you to do now is not worry about your breath so much, but you're going to contract and relax and contract and relax and lift and release, lift and release. And it's hard, isn't it? It's harder doing the faster one.
And I think we spoke, didn't we? Because I think you said to me, I was asking you about it, I said that's the one I find harder. And we said I might have a slight overactive. I mean, we won't know, but I might have a slight overactive one because of because I do CrossFit and I've always been super active. But I do.
If you struggle, if you're doing those faster ones, I find that you're not fully releasing before it's time to bring yourself back up, then you're staying in a state of contraction. You're not able to release it quick enough. So that tells me that there's an element of myofascial tension, overactivity happening within your pelvic floor, and that's where you'd go and practice the release and the stretches and all stuff.
Yeah, and I think that it would make so much sense to what we touched on. Obviously, I'm really active physically in the gym, but I run my own business, which is quite stressful. I'm always like sort of need to do this, need to do that. It makes sense, but which is why now in my pregnancy, without a shadow of a doubt, every time I'm in the gym, even if this is all I get done in the gym, it's mobility, it's breathing, it's that visualization of doing my stretching, but seeing that feeling my pelvic floor relax. And I think this is appropriate not just for pregnancy, but for a lot of women anyway, is that when they think about working out in gym, it's like HIIT training. I'm going to go for a run. I'm going to do this really quickly. But maybe they're still symptomatic of pelvic floor stuff and they need to dedicate that 5 minutes to relaxing.
If there is any of your girls who are runners, you can Google for the return to running guidelines that we spoke about. Remember
this.
They're actually really good. So they give you guidelines, and it's physiotherapists who wrote them. So they give you guidelines on what you should be able to do symptom free before going to go back to running, basically. And just to touch on the muscle fibers and stuff within the pelvic floor, like I said before, the slow twitch fibers and fast twitch fibers. The slow twitch are your endurance. So I think if I'm right, and I could be getting the percentages completely skew with, but I think it's around about 70% of your pelvic floor is made up of the endurance pelvic floor muscles. And then there's the 30% of the fast twitch pelvic floor muscles, so they will fatigue quicker. So if you are a runner and you are symptomatic when you get to say 4K, it's likely that your muscle fibers are just they haven't got the strength to kind of get capacity to get through that point. They can do, and they will, and we can train to that point. It doesn't mean you have to stop running altogether. It's just that the way the muscle fibers are made up, really, we just need to focus in on specific training for you.
Yeah.
and examine
And just
it for you.
yeah, and just building up to it, isn't it? Like you
Yeah.
said, just going everything as always, into 7 time
Mm-hmm.
and having that plan and not pushing and not, putting your ego down to the sides. Yeah,
Exactly. Yeah.
definitely.
Yeah.
Okay, so just to wrap up on Kegels then, babe,
Mm-hmm.
if we are pregnant and then if we are postpartum, because we know postpartum doesn't have a timeline.
No.
So just because you're 6 weeks after having a baby doesn't make you any more or less postpartum than when you're 20 years after having a baby. Once postpartum, always postpartum.
Yeah.
The difference in Kegels, pregnant, postpartum, the quantity. What's the word I'm thinking of? Like the quantity in the day. Oh, I can't even. Frequency. Does that
Yeah.
change?
No, not particularly. No.
What would
So
you recommend as a pelvic health physio?
when
What should we be doing?
if you're postpartum, I think if I'm right from a research point of view, they
Yeah.
say that you should be. And I'm don't quote me on this one, okay? Because I
Okay.
haven't got the research to hand. But they say it's 30 contractions, or
A
at
day.
some point they said lift and aim to hold with like 10. However, that's not for me clinically. I would look at you as an individual, so there's no
Okay.
one size fits all. And if you are
Got it.
postpartum, anytime baby feeds, so if you're sat down with baby feeding, whether it be breastfeeding or
Breast
bottle
or
feeding,
bottom.
you can
Yeah.
use that time to give yourself the gentle pelvic floor contractions. And in the early days of being postpartum, it's about reigniting that message from your brain to your pelvic floor,
Yes.
because the pelvic floor has just been through some trauma. It's
Yeah.
just separated to allow the love of your life
Baby
to
to
be
be with.
born. So you just
Aw.
need to bring your kind of relationship back and reignite
Yes.
the messages, if that makes sense. And so the early
Absolutely.
days do that. But from like people who are even 20 years postpartum, one thing I've found is that the way we work and understand the pelvic floor now is completely different to then. So I've got
Mm-hmm.
women now who are menopausal who have never thought about the pelvic floor, so they
Mm-hmm.
don't know how to contract it consciously, or
Mm-hmm.
they've overworked it because they were taught to suck in their tummy and contract up and contract up and contract up. They're the
Yeah. Yeah.
harder ones, because I've got to
Yeah.
get you to down train before I can get you
Training.
to strengthen. Lengthen before
Yeah.
strengthen is my favourite thing to say.
Really? Yeah, nice. Love that. And that's again, God, Estelle, without even knowing it, we're so going into these lovely different segments. One of the things I've got written down here, again, I know I'm not selfish, but I am pregnant, so it's a little bit about me. Is that we've spoke about Kegels, and you said about lengthen before strengthen. We have to understand that we want it to be strong, but we want it to be supple.
Yeah.
And when you're pregnant, it isn't just driving home. Do your Kegels. Like you need to relax, because if you're giving birth vaginally, that pelvic, one of my favorite phrases that I'm seeing used, obviously doing my pregnancy research and stuff, is the pelvic floor needs to get out the way,
Yeah.
like to
Yeah.
let that baby come out. And if you are so focused on working out, doing Kegels, you're high stress and you're not doing anything to relax it, that is possibly putting you in a position, giving birth vaginally, to have more of a problem
Yeah.
than doing the relaxing as well. And I
Yeah.
think it's not from an ignorance point of view. I think it's from what people are talking about point of view, is that people are
Yeah.
so conscious of, I need to work my pelvic floor, that actually they could overwork it. So it's having that balance, because like you said on the diagram, when you're giving birth, that pelvic floor needs to be able to lengthen and
Move out
shift.
the
And
way.
if you can get that breathing down and harness, and we're going into hypnobirthing now, but if you can get that breathing down and let that relax, it's going to make your birth journey possibly easier and your recovery journey like a possibly, I say possibly
100%.
because everyone's different and you never know
Yeah.
what's going to happen. But
I don't even need to touch on much of that. You've just said said everything that I probably would have said there anyway. So through pregnancy, you can, if you wanted to be part of like antenatal yoga or something like that, but you can also just get yourself in positions. Butterfly stretch, if you guys want to Google butterfly stretch, that's a gorgeous one to sit in. If you are if you have a pregnancy gym ball, get one that's relatively big, so around about 75%, 75.
I know what you mean. I don't even know what the number is, but it just says 75, isn't it?
Right.
The big gym
Yeah,
balls,
the big
yeah.
one. And when you sit on it as a pregnant lady, when you sit on it, your hips should be above your knees. If you find you sit on it and you sink down into it, you are gonna give you're potentially gonna give yourself a little bit more discomfort. So
Okay.
I want you to hips above knees, and I want you to rock forwards and backwards, so pelvis forwards and backwards. That's helping encourage lengthening through the pelvic floor by encouraging blood flow. Okay,
Love it.
and mobility of your lower back as well. So there's lovely things that you can do through pregnancy that are going to help with the pelvic floor lengthening. Have you ever thought about, so any of you guys as well, have you ever thought about perineal like massage and stuff like that as well through
So,
pregnancy?
I've only recently, honestly, mate, the world of being pregnant is like a fucking second full-time job, isn't it? But all of this stuff, by the way, that Estelle's talking about, all this stuff is going into like our Empowered Mamas course as well, which is why we're doing it. So, perineal massage, I've seen. Well, actually, before, if people are thinking what the fuck is perineal and what is that, anatomy wise, do you want to explain
Yeah.
what it is? Because again, I think it's relatively new. A lot of people don't. Taboo, isn't it?
Yeah.
Go
So
on, you go.
if you're looking at your vulva externally, you're gonna have, and you can see your vaginal opening. It's the piece of tissue between the bottom of your vaginal opening and your back passage. So it's the skin on the underneath the bottom of your vagina. So if I've got my image, if any of you can see this here, tell you what, I'll bring this in.
Yeah.
It's this bit here. It's
Perfect.
between here. So you can massage and you can use this type of position, like whatever I'm doing with, if you can see what I'm doing with my fingers there, I'm kind of doing what's kind of like
She's
a
like
foot roll.
rubbing a bogey in between a finger
Yeah,
and a
yeah, yeah.
thumb.
But you grab a piece of the skin and you can do a nice gentle massage, and you can do it all around here. You can gently pull and release, and then
Yeah.
again through to the tissues, all the way through to your back passage as well. You can kind of give just increase blood flow to them. Really, you can use from a massage oil point of view, because you buy your vagina. We've talked about coconut oil. You can
Yeah.
actually get perineal massage oil if you
Yeah.
want to.
You can get a perineal massage tool. Have you
Yeah,
seen that?
you can, but you can
It
use it
looks
as long as
terrifying.
you've
It looks
got.
like a shoe. It looks like a shoehorn.
Yeah, yeah, yeah. I know. So
That's
actually,
what I've seen. Go on.
they've got tools like that for women who've got overactive pelvic floors, and quite often we'll
Ah.
talk about those little tools that you can buy, but that's something that we'll talk about another time.
Okay, cool. So perineal massage, was you just referencing that about pregnancy? You wouldn't do that
Oh,
any
yeah.
other time, would you?
It's more so to help you through your delivery, really, because we were
Delivery.
talking about lengthening the tissues for baby to
Yeah,
come out.
perfect. So where are we? Let's give ourselves another 15 minutes and then we'll call this one an hour because it's always nice to do. So we've
Okay.
covered loads of stuff, which I love. I did want to touch, well, we did sort of touch on it really, but just to clarify, we know that postpartum means you've had a baby, whether it was 6 weeks, 6 months, 6 years, 60 years, you're postpartum.
Yeah.
And I think hopefully by now listening to us, people understand that if you had like trauma in your birth and you never recovered, you never, because a lot of the stuff we're talking about, information wasn't spoken about years ago, pelvic health physios weren't as good as what they were years ago, maybe people wouldn't have the confidence to go and see them, so they're actually living with symptoms that have been caused from birth. Like,
Yeah.
what would you say is the timeline of recovery of having pelvic floor dysfunction in any capacity? Because I know we spoke about different symptoms,
Oh, it's a
but like,
different.
if
It's a tough one, that because people will just live with it, and the longer you live with it
yeah,
and don't act on it, the harder it kind of can become to
okay,
reverse that, if that makes sense.
okay,
So
yeah, it makes
it's
sense.
been for so long, it's been seen as normal for
Yes.
women who are postnatal to wet themselves on a trampoline,
Yeah,
or can't do that, or I wet myself when I sneeze. And
yeah,
it's funny because my mum and her group of friends are all in their like mid to late 60s, and when
mm-hmm.
they laugh they all cross their legs and go, don't, I'll wet myself. And
Mm,
it's seen as being really funny, but the problem
mm,
is that is pelvic floor dysfunction,
mm,
and
mm-hmm.
it's not normal. And then there was an advert ages ago, I think they pulled it actually because people
They
complained, but
pulled it.
it was the always like advert,
Yeah.
and it was saying about leakage, and at the very end of it, the woman went, "It's normal," and it really,
Yeah.
really frustrated me because I was like, but it's not normal. So what you're
Yeah.
basically saying is these women who've got this incontinence now are going to
Yeah.
be wetting themselves for the rest of their life because it's just normal, apparently.
No. Yeah.
They are going to have vulval irritation and pain. They are going to have potentially not want to get into any relationships or have
Mm-hmm.
intercourse with their partner because they're worried about wetting themselves. You know, there's
Mm-hmm.
all of these different things. I mean, we've touched on the bladder side of things, but
Mm-hmm.
there are a lot of bowel dysfunction problems with the pelvic floor as well. So if I can just kind of touch on that,
Yeah.
constipation can give you bladder symptoms. So if you are a lady who has constipation, you need to kind of act on that, because your vagina, unless something's penetrating your vagina, it's kissing like that, it's together.
Mm-hmm.
You've got your bladder that sits anteriorly, so towards the front, and you've got
Mm-hmm.
your rectum that sits towards the back. But
Mm-hmm.
all in all, they are all squashed together like that, with
Yeah.
very thin sheets of tissue
Yeah.
between them. So if you've got an impacted bowel, it's going to push through the vaginal walls and press against the bladder, which can then cause you to have bladder symptoms, whether that be
Right.
whether that be leakage. So whenever I see a lady who's got incontinence, one of my first and favourite questions is, what's going on with your bowels? How often do you go for a poo? Is it easy to pass? Do you find yourself constipated? And we talk about stuff like that, really, because it's quite important.
So would I be right in saying then, because this is all new to me as well, so would I be right in saying then pelvic floor symptoms can be pelvic floor symptoms can come from a dysfunction in pelvic floor or something else that is causing the pelvic floor to be dysfunctioned, such as constipation can then put pressure on the pelvic floor with that, which then
Yeah.
can lead symptoms of
Well,
that.
the pelvic floor doesn't like constipation, because if and I understand that we're not 100% sure on our well, I know my anatomy, but I'm not going to
Yeah.
massively go into it. But the
Yeah.
way your rectum sits, if you've got an impacted bowel, that's going to put pressure and
Yes.
push down. That's then pushing into your posterior or your back vaginal wall. And if
Yeah.
you have an element of laxity in our vaginal walls, which, when I say laxity to people who aren't in the pelvic health world, they freak out and think
Yeah.
they've got a baggy vagina. That's not what I'm saying. The
Yeah.
vagina wall, and this kind of leads on quite nicely from a postpartum and a menopausal point of view. The vagina walls are so very plump and moist and full of estrogen throughout
Yeah.
our early part of our life. Late 30s, you start to deplete on your estrogen. And postpartum, ladies, whether you're postpartum at the age of 17 or whether
Yeah.
you're in your 40s postpartum, it doesn't really matter. But you are in
Yeah.
a state of being de-estrogenized after you've delivered. And if you're
Yeah.
breastfeeding, being having a lack of estrogen kind of continues a little bit longer. But estrogen for your vagina is so important for structural
Mhm.
support. So
Mhm.
if you
Mhm.
are in that postpartum phase, not
Mhm.
only is your pelvic floor slightly not in what we want its position to be,
Yeah.
but you're de-estrogenized as well. So you're going to feel a little bit more symptomatic for the first few weeks. That will
Yeah.
improve. But if you
Yeah.
are breastfeeding and you're planning on breastfeeding for quite some time and you've got vaginal discomfort, you feel a bit heavy, doesn't always mean you've got a prolapse, so don't freak out
Yeah.
about it. You feel a little bit heavy, sex becomes a little bit painful, you feel dry, you feel itchy, speak to your GP about having some vaginal estrogen pessaries to get you
Yeah.
through that postpartum breastfeeding phase, because you
So
are
helpful.
allowed it.
Yeah.
Equally, our ladies who are perimenopausal and menopausal, same
Yeah.
symptoms, because they mimic each other. So if you have got vaginal dryness, irritation, pain, heaviness, all of those things, you can speak to your GP, and as long as they're happy, they will prescribe you some vaginal estrogen pessaries, and I can guarantee your symptoms vaginally will feel a lot better.
So good, mate. You are absolutely amazing at your job. Honestly, you are. So I could just listen to you all day. Absolutely could. And I'm sure after this podcast, we'll get people messaging and asking more questions and stuff as well.
Yeah.
Thank you for sharing that. And I think, again, even me,
Yeah.
I didn't know that, And if you don't know, you don't know, and you don't ask, do you? But yeah, so I think that answered, like you said there. We touched on like about recovery of pelvic floor. It's very individual. Depends what your symptoms are, how long you've been
Yeah.
having them.
Yeah.
General consensus is you'd experience symptoms postpartum, like early postpartum, normal. They should relieve 12 weeks. I couldn't back you more. If anybody is listening and is like me, go through a pregnancy journey, one things I am so excited about, and Estelle very much knows this, is I'm going to go and see Estelle for a what would you call it, be like a pelvic health assessment?
A postnatal review.
Postnatal review, yeah.
There's
So what Estelle was talking about then is 12 weeks. I will go and see Estelle, and I would love to do something for Instagram, like, so maybe we'll talk about like recording it and showing people what's involved in it, because I'm not shy. But yeah, so like an internal examination, external examination, look at my breathing, how my pelvic floor is recovering. If anybody is going through pregnancy, this is something I would highly recommend that you look into post-birth. Unfortunately, they're not on the NHS.
No,
is that right?
No, yeah,
but they are in, like, I think France.
Yeah,
they are, and stuff like that, and which
France have
shows
always been
how
pioneers in pelvic.
how. Say that again.
France have always been really good with supporting women postnatally in pelvic health and stuff.
Because I think they get like free physio as well, don't they, or something like that.
Yeah.
It's amazing.
Yeah.
But unfortunately not on the NHS, but definitely worth an investment. For me, it's an absolute no-brainer. Like, if that is the one thing I'm doing, 100%. Because again, if you are, like Estelle said before, if you have symptoms postnatal that aren't shifting, or that, unfortunately might be getting worse, it's not just living with them, because that is going to affect you for your ongoing life, and possibly, in your future, like 10 years down the line. Am I correct, Estelle, just before we move on to the last bit of Q&A, in saying that women who suffer with prolapse, that maybe they didn't get prolapse straight after birth, but the prolapse has come from living with untreated symptoms that have then progressively got worse with lifestyle, maybe perimenopausal, drop in estrogen, stuff like that.
Yeah, so all of those things. So you can develop prolapse symptom. Oh, sorry, I'm thumb upping you.
I know, don't worry, I love that.
You can develop prolapse symptoms through delivery, unfortunately, through excessive pushing of a baby, and you can develop it going into your menopause just because the estrogen has changed, and one day you climb a mountain or you sneeze, and the support structure changes. So prolapse is not something that is ever guaranteed that anybody's going to get, but it's also can be quite common and can be treated relatively easily. I mean, in our pelvic health world, we've got waiting lists, easy 9 months. So you get referred through your GP, it's likely you're going to be waiting about 9 months from an NHS point of view to see a pelvic health physio if you've got prolapse symptoms. But that just shows you how many people have these symptoms, seek support, because we do have a good outlook as well from it. So pelvic health physio is the first port of call for anybody with prolapse symptoms and also associated symptoms, so bladder, bowel, pelvic pain, all of those things. So you'd see us, we'd examine you, we'd see the level of support from a vaginal point of view, we'd talk to you about your bladder symptoms, we'd talk to you about your bowel, and we'd also assess your pelvic floor function, and we'll continuously assess your pelvic floor function on most appointments. It's not always necessary on each appointment, but that's the aim, is to assess and see whether in between your appointments you've managed to make a change, and we'll guide you with it. We can't do it for you because it's your muscle, but we can guide,
like everything, isn't it? You can give them the right thing. No, that's perfect. Great. Right, love that. We've got through all of our lists, which is amazing. Let's just go over some questions that we put on Insta, shall we?
Okay.
How many have I got? I don't think I've got 4, so didn't get that many, but we'll go through them, and some of them we might have already answered. So, first question: is it possible to lift heavy weights wrong and over time weaken the pelvic floor? I think we sort of answered that one. Like, it is possible. When it comes to, if it's okay, I'll just quickly answer this one, because obviously like training stuff. But when it comes to your breath and training, God, it's like a whole separate thing that you like a workshop really that you want to do. But like, if you think of it like Estelle and I were talking about it before, your pelvic floor is there as a support network, and if you haven't got the if your pelvic floor hasn't got the strength to support,
range
yeah,
of
yeah,
movement.
yeah, the range of movement, and you're lifting and not bracing in the correct way, and like we can talk about the Valsalva breath. Do you talk about that in
So when
your
you,
work, but not necessarily
if you're lifting a heavy weight and you are not you're not engaging your pelvic floor in the
pelvic
correct
floor?
way, it's going to
Yeah,
push down, isn't it? It's going to
yeah,
override the pressure, and over time,
exactly.
it's going to give you symptoms. So,
And it's getting to the
essentially,
symptoms.
that is lifting heavy weight in the correct way with the incorrect way, with the incorrect form, can give you pelvic floor dysfunction. However,
Yeah,
if you are a weightlifter and if this is your life, then
yeah,
we don't want you to go, oh, you're not allowed to lift
yes,
anymore. We will
yeah,
help you get to a point of where you can lift. It may be that you can't lift as heavy as you want to straight off the bat. We have
100%.
to make
Yeah,
sure that you are looking after the foundations and then pushing
absolutely.
forward, seeing whether you can do that, and then you can do that safely. Okay,
Yeah,
so let's see there. And there are physios out there who actually get you to do what you want, and then if you're
yeah,
symptomatic, they bring you back. So they don't grade you from bottom to top. They'll grade you to,
yeah,
okay, so what you want to lift? Are you
yeah.
symptomatic? And they'll bring you down until you're not symptomatic, and then build you back up.
Okay,
So
back
there are
up.
loads of different ways.
Yeah, and I think the biggest thing for me on that one is, it, like you said, starting from the ground up, but you need to make sure that you are doing your technique properly, which under technique is breath work.
Mm-hmm.
So it
Yeah.
isn't just, keeping your back straight and pulling your shoulders back.
Mm-hmm.
Which is why I do a lot of form checks with my clients, is I
Mm-hmm.
will look at their breath. What is their chest doing? What is their shoulders doing? What
Yeah.
is everything doing?
Yeah.
So yeah, that answers that question. Okay, so this question is, I got a prolapse after pushing. The GP says just keep doing Kegels and see how I get on. Is that right?
But I'd like to know. I mean, I don't have her postpartum, so I don't know
Exactly.
how far she is.
Yeah.
The GP, ideally, you should have had a referral through. If you're symptomatic and you're concerned about it, you should have had a referral through to pelvic health physio, and you are allowed to ask for that. You will be waiting unless you want to come in privately and have an
Yeah.
assessment. But if you're concerned about it, it's always worth reaching out sooner rather than later.
Yes.
He or she has advised you to do Kegels. Do you even know? I mean, obviously now we talked about it, but at that
Yeah.
point
You do
they taught
now.
how to. Like,
Yeah.
it's not an easy. It's not the right advice. I don't think that the
I
GP's
don't
giving you.
think. I think it's lazy advice.
Yeah,
Yeah.
but
I
your
think.
question
Yeah.
being is, were you assessed at your 6 weeks check and told that you've got a prolapse? Because that's also incorrect. Being
Yeah.
told you've got a prolapse when you're that soon postpartum is probably not the right thing to say, because it might not even be correct.
Mm-hmm.
Do you know what I
Yeah,
mean?
I 100% I agree on that one. Yeah, and I think as well, just this is a bit like off the course, but with pelvic floor and also perimenopause, menopausal symptoms, if you are not happy with the advice that you are walking away from the doctors on, and
Mm-hmm.
you feel fobbed off, go back,
Yeah, go
ask
back.
again, and keep
Yeah.
persistent. Yeah, because
Mm-hmm.
unfortunately, as we know, we get really good GPs, and if I ever went through the NHS and got you as my pelvic health physio, I feel like I'd fucking won the lottery. But also, we know that there's other people that aren't as passionate at wanting to help people as like you are. So yeah. What even is pelvic floor? Nailed it. We've done that one. Okay, so this is one. So shock incontinence. Can pelvic floor exercises help with this after physio? Can pelvic floor exercises help with this, as after physio I still suffer with this issue? Did
Okay.
we cover what is shock incontinence, sneezing?
I think she means stress incontinence. So stress
Okay,
incontinence is not something that the term that we'd use, but stress
okay,
incontinence is probably what she means. And
right.
again, yeah, so stress incontinence. Oh, sorry, my battery. So stress
Okay.
incontinence is, like we've already touched on. If you've already been through pelvic health physiotherapy, I'd like to know, when did you go through it, and
Mm,
have you what type of treatments did you do? Because
mhm,
even up until like 10 years ago, pelvic health physios would give you like little devices to go into your
mhm,
vagina to give you pelvic floor strength.
mhm.
However, now we know that the pelvic floor, especially with stress incontinence, is most likely because the pelvic floor is too stiff. So
Too
why
tight.
would you then
Yeah.
go and make it stronger? Do you get what I
Yeah,
mean? So
hundred
I'd like
percent.
to know, when did you see physio? What treatment did they give you? And would you be interested in kind of coming back through the system, whether that be NHS or privately?
I love how many people are going to listen to this podcast, go to their GP and be like, so listen to this podcast with the pelvic health physio, and I feel like I need to come back again. So yay.
That'd be good.
Yeah, I would love that. Okay, so babe, that is everything. We are done. We have encompassed, and this podcast, honestly, I'm not even joking. I think I've done like over maybe coming up to 200 is one of my favorite
Yay.
podcasts, and I think it's everything I wanted it to be, and I think it is going to be a huge help, relief to so many women. So thank you. I've got
No
goosebumps
problem.
for coming on and giving us your time. It's been amazing. We will get you back on and we'll talk about a bit more maybe about pregnancy,
Yeah.
definitely about postnatal as I'm going through it and stuff.
Okay.
And obviously we're working together on the Empowered Mamas course. So anybody who is thinking about pregnancy or is going through pregnancy, maybe going to go through another pregnancy, this course is going to be available to you this summer. And me and Estelle are going to make sure it is full of everything you need to know to have a safe pregnancy journey and keep up training and strengthen your pelvic floor, lengthen your pelvic floor, and do everything we can. But Estelle, just one more time for everyone listening, what is your Instagram, please?
So it's at physicate_physiotherapy. So physicate is spelled PHIS, I think.
It's on my followers. You can follow me. Yeah.
CATE. And the
And I'll put
reason
it
being,
in the notes as well.
everyone thinks my name's Kate. It's not.
Okay.
It's not.
Yeah.
But it's because I liked physiotherapy and I like educating people. So I put them both together. But I've got a lovely manager called Kate, who's a fab physio, and I feel like, oh my god, people are going to think my name's Kate. I do apologise.
Nah, it's a funny story. Don't change it. I like it. It's good. Everyone thinks my name's Emma. It's one of my pet hates ever. Like, hi Emma. I'm like, it's fucking Emily, but it's fine. Yeah. But yeah, guys, Estelle, thank you so much for coming on. You've been an absolute knowledge bomb legend, which I knew you would be. Everyone else who's listening, go and help us out. Rate the podcast. Share it on your socials. Send it to your mum, your sister, your nan, your friend, your cousin, anybody who needs to listen to this. Please spread the word. And as always, you can get in touch with myself or Estelle on Instagram. Mine is @_em.powered. Both of these will be in the notes, and we will see you next time. Thank you for giving me your time of listening today. Have a great day. Love you. Bye.
Bye.